Shalom, beloved. My name is Ms. HiSmith, and I'm so glad you've decided to join me here for the APA Apology Response series under the FREE² Movement. Beloved, if you are not aware, back in February of 2021, the American Psychological Association, also known as the APA, released a public apology to people in communities of color. In this apology, they acknowledged their role in promoting, perpetuating, and failing to challenge racism, racial discrimination, and the flawed notion of human hierarchy in the United States. Beloved, we are going to start specifically with paragraph 18 of this apology, where the APA states, and I quote, "Whereas the field of psychology has not historically supported research on communities of color by not adequately reporting and including them, minimally reporting them as a demographic data point, and/or interpreting results based on Eurocentric research standards." Closed quote. Beloved, this opening clause is a hard truth. Historically, the field of psychology has failed to adequately support, report on, and include communities of color in meaningful research. Let's break this down and explore what this has looked like in practice, beginning with the key ways psychology has contributed to this historical exclusion. Number one, historical exclusion from research, lack of representation. Early psychological research primarily focused on white, middle-class populations, neglecting the experiences and perspectives of communities of color. For example, foundational theories by Freud, Terman, or Watson were built around Western norms, which were then broadly assumed to be universal. Next is ethnocentric bias. Beloved, many psychological theories carried ethnocentric bias, assuming that Western cultural values applied across all populations. This flawed thinking prevented the development of culturally relevant research to address the mental health realities of diverse groups. Number two, through methodological issues, cultural bias in testing. Beloved, let's remember, intelligence tests like the Stanford Binet IQ test, these tests developed in the early 20th century were culturally biased, built with assumptions rooted in Western norms. They mislabeled communities of color as, quote, inferior, reinforcing harmful stereotypes. Through inadequate measures, tools and methods in research failed to account for cultural context. When measurement tools don't align with a person's lived experiences, the results are incomplete, inaccurate, and sometimes harmful. Number three, research focus and priorities neglect of relevant issues. Systemic racism, racial trauma, and culturally specific mental health needs, these critical topics receive far less attention than issues affecting white populations. What does that say about research priorities? Well, it produced underfunding. Historical funding patterns demonstrate a consistent lack of investment in studies focused on communities of color. Without resources, beloved, the scope and scale of research remained limited. Number four, ethical concerns and exploitation ethical violations. The Tuskegee syphilis study is a painful and prominent example where ethical boundaries were crossed. Black men were subjected to harm under the guise of research, without consent, care, or justice. Tokenism. Communities of color were often included as mere, quote, data points, to check a box without a genuine effort to understand their unique needs and experiences. Number 5, consequences of exclusion, misapplication of findings. Beloved, when research is built on exclusion, the resulting therapies, practices, and policies fall short. Mental health treatments rooted in Eurocentric ideas often fail to heal or even reach communities of color. Reinforcement of stereotypes. Without intentional representation, psychological findings risk reinforcing stereotypes and perpetuating a skewed narrative about people of color. So let's pause here. Beloved, what has the result been? Silence, invisibility, and pain. But as with all things, truth reveals itself, and justice makes way for change. So, what are the efforts to address the gaps? In response to these wrongs, the field of psychology has begun taking steps towards more inclusive practices. There's been an emphasis on diversity. Research institutions now encourage diversity in sampling, analysis, and reporting. Guidelines for cultural competence research. The APA has published guidelines aimed at eliminating these inequities. Funding and platforms. There are now specialized funding programs and journals, such as the Journal of Black Psychology, dedicated to amplifying voices and addressing issues impacting communities of color. Beloved, while we celebrate these steps forward, we must remain vigilant and committed. The work is far from finished. Now let's continue. The next clause reads, and I quote, minimally reporting them as a demographic data point and or interpreting results based on Eurocentric research standards. So let's unpack this together, beloved. Minimally reporting communities of color means that many studies have failed to disaggregate data, lumping diverse racial groups into broad categories. This approach erases nuanced experiences, masking both struggles and strengths within the communities. Read with me about the Eurocentric research standards. Beloved, psychological methods built on white Western norms have often misinterpreted or invalidated the realities of non-white Western cultures. For example, Black and brown individuals may express trauma or grief differently than their white counterparts. When the standard does not reflect that truth, people are often misunderstood and worse, underserved. Let us reflect on this, for psychology should be a tool for healing. Yet in the hands of bias, it has historically contributed to harm. But beloved, I believe in redemption and repair. And if we can name these injustices, we can work to correct them. This is what the APA Apology Response Series seeks to do. And this is what we must hold them accountable to. In our next session, beloved, we will continue dissecting this apology, line by line, precept upon precept, so we may understand, heal, and move forward in truth. Thank you for joining me today for the FREE² Movement and the APA Apology Response Series. My name is Ms. HiSmith, and as always, I invite you to lean into freedom, justice, and the power of knowing. Until the next time, shalom, beloved.